Hello, and thank you for joining us today. We're going to talk about a very important topic on how to create your own online Medicare.gov account. It's very important. But before we get started, I want to tell you a little bit about affordable Medicare solutions. We are Georgia's #1 Medicare planning agency. We were started 26 years ago, and we have now 9 employees, soon to be 10. And our agency is a year-round agency to help people manage their Medicare. We are not a set it and forget it agent. We help you with your life changes. If you're moving, if you're losing a spouse, if you're just having annual reviews to make sure that you're on track with your Medicare, we do all of this for free. So Medicare is not set it and forget it. It's not something you just sign up for. You do have basic Medicare, but you have to add to Medicare additional features and programs to complete the process. So not managing your Medicare can be a big mistake, both financially and concerning your health. And Medicare is something that you will manage each year. At the end of each year is the annual enrollment period, and that is October 15th through December 7th. And also they give you a 2-week preview period, October 1st through October 14th. So that's the end of the year, and all of your new plan choices will take effect on January 1st. These yearly changes that can affect your plan include how much out-of-pocket expense do you have if you get sick. Also, Medicare changes the hospital deductible and outpatient deductible for Medicare each year. Definitely, your drug costs can change every year. And that's a big issue for fixed income seniors. But also, what about your doctor? Is your doctor going to continue seeing Medicare patients? Is your doctor going to be in your plan? Or is she joining different networks and changing the way her practice behaves? Also, what about your pharmacy? Did your pharmacy chain change the way that they deal with Medicare? You have to make sure. There is help also for people who are low income or have chronic illnesses. So a few years ago, Medicare decided to create the ability for you to create a personal login at the Medicare website, just like you have at your bank or your credit card. So this Medicare.gov, make sure you're at the government website, account is very effective, and it is being improved all the time. They're doing a great job. So once you get your Medicare ID number, which is an 11-digit alphanumeric code on your red, white, and blue Medicare card, once you receive that, you can go to Medicare.gov and you can manage your account there. Now there, you can print out a temporary ID card in case you lose your red, white, and blue card. You can just simply print out a new one or an extra one. And it'll show you all the in-force status for all of the Medicare plans that you have and your previous coverage. It also helps you to analyze and select new Medicare plans, such as your drug plan called Part D every fall in October and November. We help our clients do all of this for free. There is no charge, so that you don't have to manage this on your own. Although Medicare makes it in a system that you can manage, we'll do it with you for free, and you get professional guidance each year. So this is what the Medicare website looks like. It says Medicare.gov. Make sure you're on the official US government site for Medicare and not some other website. Be careful. There are scams out there. And when you go in, click on where it says login/create account. Right here in the middle of the screen, circled in red. And it's important. Also at the bottom, it says, once you click that button, it says no account, create one now. And when you click that button, it says create account, and you have your Medicare 11-digit alphanumeric code you put in the first box. And then you put in your last name, your email address, you confirm it, date of birth, your zip code, and when did your Medicare start? Either Part A or Part B. The first thing you typically get is Part A, put the date in that box. And once you're inside there, it's great. They have buttons you can push that say, hey, tell me if my doctor got paid, and you can click on view my claims. Well, what if you took an ambulance ride and they didn't know your Medicare number, and you notice in here that the ambulance never billed Medicare, but you got a bill from the ambulance service that says you owe $1,300. Well, maybe you don't owe that money. Maybe they never filed a claim with Medicare. You can check it right here online. You can also pay your Medicare premium. So that's a very handy function that they created recently. And you can manage your account and change your address and change other information. But what's really neat is now your drugs that you're filling under Medicare are reported into this account so that you can actually have your drug list. And that's handy to have, to print out, to carry with you in case you were in an accident or some illness. You could show the doctor or the hospital, yes, this is my current drug list that I'm using. And you could print out the temporary Medicare card, and you can also look up Medicare providers. This is the first time you can have the ability to look up doctors and hospitals and facilities that take Medicare. But what's the best thing at the end of each year that you can do is you can do your own Medicare plan comparisons. We do this for our clients for free, but if you feel competent, you can do it yourself. And this is where you can go in and it already knows what drugs you're using. You can check off to make sure that the list is correct. You can add your pharmacy to make sure they have the right one and push go. Once you set that system moving forward, it looks at all the drug plans. For example, we have nearly 30 drug plans per county in Georgia this year. Next year, it might be 35. It keeps changing. And so your drug plan that you're on next year might not be the right drug plan. And when you do this comparison, it tells you very quickly, hey, here's your current plan that we have registered for you. And next year, it shows you comparing it versus the next number one versus number two versus number three. Your plan might be number three, and it may show you, hey, you can save money by moving. And if you look down here at the bottom of the chart, I use 2 pharmacies. You don't have to use just one, and also mail order. So you can do 3 pharmacies. We did Publix and Walgreens on this example. But look at this. One plan at Publix has your drugs next year for $39.60. The next plan, same pharmacy, $61. And another plan shows, no, Publix is out of network, $195 for the same drugs. And mail order is the same thing. They also have a variety of charges. It goes from $39 to $45 to $66. So a simple little exercise can save you a lot of money. The average error is not $20 like we're showing on this chart. The average error is $720 per year per person by not doing this simple exercise. We can help you with that. So our agency is Affordable Medicare Solutions. We offer free Medicare planning services. Our phone number is 770-945-5261. We have a great website and a great YouTube channel where you can find out lots of extra information on your own, or you can just call us and we'll walk you through everything. Thank you very much for joining us today.